Hello and welcome. In this video, you'll learn how to remove an intrauterine device, or IUD. Women may want to have their IUD removed because they want to get pregnant, they no longer need contraception, they have reached the menopause, their partner has had a vasectomy, or through changed personal circumstances, or they are not happy with this method and want to switch to another. Before you begin the procedure, make sure you've offered the correct counseling for each scenario. See the accompanying document for more information. Before you get started, make sure you've got the right equipment. You'll need a speculum, lubricating jelly, and an instrument to grasp the coil's threads. This could be a Rampley sponge-holding forceps, or a long Spencer Wells forceps, although do be careful not to pinch the patient, or a Pelican coil remover. Remember, if a woman has had sex without using a condom in the 7 days before IUD removal, she could conceive immediately after the IUD is removed because there will be viable sperm in her genital tract. Always advise women at risk of pregnancy, who do not want to conceive immediately, to abstain from sex or use condoms for the 7 days prior to removal of IUD. Most devices used in the UK are T-shaped and have 2 threads attached. The device is about 5 centimeters long and will be sitting at the top of the uterus. There will be between 2 centimeters and 5 centimeters of thread in the uterus and cervical canal. There will be about 3 centimeters of thread in the vagina, usually curled around the cervix. Pulling on the threads brings the device down into the cervical canal. The arms then fold upwards to make the device long and thin as it comes through the cervix. Visualize the cervix, and you should see the threads coming through the OS. The threads may be sitting on the surface of the cervix. Lift them away with your removal instrument so that you can grasp them. Close the jaws of your removal instrument around as much of both of the threads as you can grasp, and close tightly, locking onto the threads. Apply firm straight traction to the threads with the removal instrument, and the IUD will slide out through the cervix, into the vagina, and then outside. If the IUD does not come out easily, stop the procedure and refer to an experienced colleague. If there are no threads visible, this could be because the threads are up in the uterus, or the device is no longer in the uterus. It may have fallen out unnoticed, or it could have perforated the uterine wall and be in the abdomen. Advise the woman to use condoms if she is at risk of pregnancy until the device is located. Consider the need for a pregnancy test or emergency contraception, and refer to an experienced colleague. It may be useful to arrange an ultrasound scan. After the procedure, ensure the woman knows how to use her new contraceptive method and has adequate supplies. If no new method has been started, the woman must abstain from sex or use condoms from the time the IUD is removed if she wishes to avoid pregnancy. Clearly document the discussion and procedure in the medical record. Thank you for watching.